Good afternoon. Thank you for listening again today. As of 2 p.m. today, there have been 1,834 positive cases of COVID-19 in Missouri, including 19 deaths. Like I've said, as more and more people are tested each day, these numbers will continue to rise. But I want Missourians to know that we are and will continue to do everything in our power to protect public health. Day in and day out, we're working around the clock to respond and adapt to COVID-19 in every way possible. Nearly every hour, we are reevaluating the situation and looking at all of our options and resources. I am in constant communication with leaders and medical experts across the state on a daily basis. Today, I signed our 6th executive order in response to COVID-19. This executive order suspends late penalties for concealed carry license renewals. Many people are worried that it will be assessed a late penalty if they don't renew their concealed carry license before it expires, which would require them to go to their local sheriff's office. These people should not be penalized for staying home like they've been asked to. This executive order not only promotes public health and social distancing, but also frees up local law enforcement officers from administrative tasks. In addition to 6 executive orders, we have now waived or suspended 276 state statutes and regulations. We have approved the purchase of tens of millions of dollars worth of PPE and are working rapidly each day to get these shipments out. We have requested and been approved for a federal major disaster declaration in the state of Missouri. We have mobilized the Missouri National Guard to further assist our efforts, and they are working to identify potential alternative care sites, if needed, around the state. Again, I want Missourians to know we are working extremely hard for the people of this state. Not just government, but our doctors, our nurses, public health professionals, law enforcement, first responders, truck drivers, grocery store workers, and all of the Missourians who are on the front lines every day. We cannot do this alone, and we cannot thank all of you enough for your efforts during these challenging times. A tremendous amount of work has already been accomplished, but it does not stop here. We will continue to exhaust all options until Missouri overcomes and fully recovers from this crisis. With that said, General Compton is here today to give an update on the Missouri National Guard. General Compton.
Thank you, Governor. Again, thank you, Governor Parson. Hey, a few days ago, when the governor mobilized the Missouri National Guard, I spoke to you about the role of your Guard across the state and our mission to support our partners and communities across this great state. The mission has not changed, and we remain committed to help the citizens of Missouri while also ensuring we are ready as this crisis unfolds. Let me assure you that your Missouri National Guard continues to be focused on the health and well-being of our citizens, our service members, and our families. We are trained, well-equipped, and prepared to do what it takes wherever we are needed to fight and win this battle against COVID-19 as one team. We continue to work closely with our teammates across Missouri. We remain fully integrated in the planning and execution of the COVID-19 response efforts with the governor, the Department of Public Safety, the State Emergency Management Agency, the Department of Health and Senior Services, Missouri Health Net, and others to support a coordinated response. Our main effort to date, in conjunction with state and federal agencies, including the United States Army Corps of Engineers, has been to facilitate and perform alternate care facility site assessments. An alternate care facility is a site where temporary medical facilities can be stood up in the event existing medical facilities become overwhelmed. These sites are geographically dispersed to be able to support the entire state if needed, and to also allow the greatest synergy with existing healthcare systems that can take on the operation of these facilities. The plan is to focus on the conversion of hotels first so that an immediate surge capacity can be attained while simultaneously working some larger venues to give the state's healthcare system the flexibility to quickly expand if needed. We are proud to be part of this team effort that will have a direct impact on the welfare of Missourians. Also, as I stated previously, we are also prepared for other potential missions, so expect to see your Guard forces across Missouri in support of state and local authorities. I've mentioned some of those missions may be helping to set up community-based testing sites, operation of those sites, providing interstate transportation of personnel and equipment for medical or testing support, and logistical support. Although we will bring all of our available assets to bear against these missions to ensure success, we want to assure the citizens of Missouri that we are doing it smartly. Several of our soldiers and airmen serve as first responders or medical providers in their civilian jobs. We assure you that we are not mobilizing those individuals and pulling them away from these critical positions unless it serves the greater good. Let me also say there are a lot of rumors out there and false messages on social media about the Guard's role in this fight. I ask you to look for the truth on the Missouri National Guard social media platforms, our website, and press conferences like this one. We are in this fight together, and we want you to know what we are doing to help you. Okay, I'd like to end by saying how extremely proud I am of our healthcare workers who are on the front lines providing the vital medical support needed to save Missouri lives. I thank you for your service, your dedication, your exhausting work. Right now, as never before in the history of our nation, you are our rock. The entire nation is standing on your shoulders, and we want you to know that we are here to support you in winning the fight against COVID-19. I'm also proud of our citizen soldiers, our airmen, and the citizens of our great state. Please follow the advice and direction of your state and local authorities and help us win. We have your back, Missouri. Your Missouri National Guard is in this with you. We'll win as one team and come through this stronger together. Thank you very much.
Thank you, General, very much. Thanks for the update. As we all see on national TV what our military men and women are doing all across the United States right now, how they're working to work against the COVID-19 and what they're doing and what we're seeing them. That's exactly what our Missouri National Guard is preparing for, to be there when we need them. And under General Compton's leadership, I am confident the men and women that serve the National Guard right here in Missouri will be able to meet the call when that call comes, if it does come, to be able to help the everyday citizens in this state. And General, I'm proud of you and the men and women that serve this country here in the state of Missouri. I thank you. Before I turn it over for questions, I want to address some recent concerns regarding unemployment claims. We are very aware of the fact that people are struggling to get through to the Department of Labor. But what we need Missourians to realize is that the unemployment claims are at unimaginable historical highs. The Department of Labor is receiving over 100,000 calls each day. For the week ending March the 28th, the department reported over 104,000 initial unemployment claims. We have prioritized unemployment claims, and over 90% of the people have been able to file their claims online, which has experienced only 1 2-hour period of downtime. Many people are also asking questions about the recently passed federal legislation regarding unemployment for the self-employed and the $600 supplement. We just received news that since Missouri signed an agreement for claims filed on or after March the 29th, after the federal government issues guidance and releases those funds. Kelly, you got some questions today?
I do. Governor, I have a couple for you, and then Dr. Williams, I have a few for you. Governor, we'll start with you. Brian Kaler from Word and Way has a question. Governor Parson, the coronavirus hotspots across the nation have been traced to church services. But unlike some other governors, you said religious gatherings were exempt from the state's social distancing order. Why?
Well, the churches fall into the same order we provided early on. When the first order, when I talked about social distance, social gathering, the churches fall underneath that as well as anyone else. We have been in constant communication with the church leaders across the state every week since this have, trying to realize the important role that they play in this crisis right now. And they have an extremely important role to play. And I'm thankful for all the alternative ways that they've been able to provide those religious services to people every day, and continue to support them. I challenge them to pray for our state, to pray for our country, and to be able to help. But the churches fall in the same requirements as the people under the order.
Okay, Governor, the second question is from Kara, which is Fox 4. Can the governor please address any considerations that he may have on preventing people from getting evicted or any type of rent relief for Missourians worried about that without income from business closures, they will not be able to pay their bills?
Yeah, we're aware of that situation. I've reached out to the courts right now, to be right honest about it, talking to the Supreme Court. The courts does not have that as a priority on the eviction side of things. So right now, I don't believe that's going to happen through the court systems, through the proper channels you go through there on that. So I believe that problem is taken care of at the time, and until we get through this crisis. But I don't believe that's going to be happening across the state. And I think I think it's important, again, that we try to make sure to maintain what role government plays in some issues and what the private sector does. But right now, we've reached out to the Supreme Court. I talked to them personally, and right now that's not a priority on the court dockets for what they're doing right now.
All right, thank you, Governor. Governor, this one is from Jacqueline Driscoll, St. Louis Public Radio. Are you still communicating with local leaders, emergency personnel, mayors, community officials across the state?
We're reaching out to all organizations almost every day of the week, including Saturday and Sunday. We talk to the mayors, we talk to county executives, we talk to the religious, to the clergy, sometimes with almost 400 people on those conference calls that we're having. The local levels, we stay communicated with them. We stay communicated with all the statewide, to the government entities across the state. It is important to me, one, to be transparent, and two, to make sure those communication lines stay open, that people really understand why we're doing it. We talked to one of the most rewarding, I want to say, conversations I have is with the doctors that I talk to every week on the disease of where that's at, how they view it from their perspective, and how the hospitals look at it. We talk to medical personnel. But we're in constant communications with people on the front lines daily here at the governor's office. And we're going to continue to do that because it's helpful for us all to understand what the situations are.
Okay, Governor. Chad Mahoney from WGEM-TV in Hannibal, Missouri. In Northeast Missouri, especially in the immediate Hannibal area, tourism is essential for the local economy. Owners of hotels, shops, and attractions have expressed fear that tourism may not come back at all this season, even after COVID-19 restrictions are lifted. Do you have a plan to assist and preserve the future of the state's tourism industry, which is made up of many small businesses?
Yeah, every day we're trying to figure out how we put the pieces together and hold them together. Tourism's always been a priority of mine. I think it's a huge impact on the state of Missouri for who we are and what we represent. And I believe tourism will come back once we get past this virus. But it's going to be tough. It's going to be tough for a few months, and everybody's just going to have to realize that it's going to happen. But I'm going to do everything I can as governor of this state to make sure that we're able to get people into this state when it's safe, when we get past this virus, and we try to promote tourism, whether that and whatever resources I have to help that. We're going to try to find that out as much as we can from government's position.
All right, thank you. This question, Governor, is from Amber. She's with KMIZ. I was curious if Governor Parson foresees any restrictions or withholdings on K through 12 education in fiscal year 20.
Right. For fiscal year 20, I do not. We felt like we did a supplement. We've got the legislators looking at that right now, but we're going to try to keep that their funding intact as much as I can for the time being. But I also got to emphasize, this changes daily. The finance of this state, we are watching it daily, where you used to watch it kind of on a month at a time or quarters at a time. This is really having a huge impact. So we're watching that every day. But with that being said, we don't have a plan. We don't have a plan in place right now to restrict any funding through K through 12.
All right, Governor, this is the last question for you from John O'Sullivan, KMOV. As of today, why have you not issued a statewide stay-at-home order, and you are still sticking with the order to social distance and keep gatherings at less than 10 people?
Yeah, because that order was done 2 weeks ago. When we did that order, we said we would evaluate that at the end of that order, and that time is coming. And we're in the process of doing that. Tomorrow, I hope to be able to give some more details on that. But I think it's also important to understand, when you're the governor of the state of Missouri and you try to do a statewide order, our state is so diverse. For every segment of the state is different. And it's very difficult sometimes to put a blanket order in place. And then when you start looking at the exceptions that you're going to do, or what is the essential businesses are there, because they differ from whether you're in a big urban area or whether you're in a rural area. So we're working on that. We're going to figure out a solution that hopefully we're going to be able to announce more on that tomorrow.
Okay, thank you, Governor. I have 2 questions now for Dr. Williams. Dr. Williams, this is from Jacqueline Driscoll, St. Louis Public Radio. Some residents in the state say they've been tested for the virus, but were originally told they would receive results in 3 to 5 days, only to be told later that it would be up to 14. The reason they were given is lack of test processing capacity. How is the state working to eliminate this issue, and are you noticing that it is a widespread problem?
Thank you for the question, and yes, the answer is we are seeing that. It just so happened I've been to every county in the state, and this morning I talked to a doctor down in Pemiscot who's opened up his urgent care clinic to 10 o'clock at night to see patients for COVID-19 testing. And I talked to a doctor head of a large system up in St. Joe's. And we do that every day to learn from our colleagues what's going on all around the state. And so as I look at it and listen, it appears, especially for some of the larger commercial labs, that they tend to batch them, and so it can be. I talked to a local health director this morning, and I think they were at about 8 days from a large commercial lab. I would tell you for the smaller labs, there's one that is giving back test results the same day in mid-Missouri. So there is a range. Again, our guidelines are such that for the 3 groups of people we're looking at, we will get it back to you the next day, and we've never wavered from that. And that's about 75 today, but we're now up to about 19,400 tests. And certainly some of those are coming back as late as 7 to 9 days, and I know that's frustrating. But again, I would also say some of them are coming back in the same day. I think a good question when you get your test is to ask your provider, of those 2,500 to 3,000 tests, when do you think my test will come back?
All right. Dr. Williams, this is from Caitlin from the Kansas City Star. How long is the current supply of ventilators expected to last if COVID-19 continues to spread at its current rate?
Again, thank you very much for the question. We are now in that very much, what we call modeling for surge capacity. You see different models from Washington, Dr. Murray's, you see one out of Boston. But we are at the point now, because of our testing, we have enough data to match that to what we know as our foundational kind of background health foundation here in Missouri. And from that, we start looking at things called case fatality rates. For instance, Louisiana's is twice that of California's. So it's the same virus, same disease, but in different environments, it has very different morbidity and mortality. We have enough data because we've done very purposeful testing that we're now matching that up, working with our partners from HHS and the Missouri Hospital Association, our own experts. And so at this point, yes, we get the information daily. We have enough ventilators. We have on reserve that we have a well laid out plan. If an area such as St. Louis or Springfield should have a deficit, we can supply them with ventilators. Tomorrow, again, because the governor wants us to be as transparent and he knows people are asking those questions, we will start releasing regularly the number of patients in hospitals with COVID-19, the number of ventilators we have, the number of ICU beds we have available, and hopefully how long patients are coming in and out of the hospital, how quickly they're being discharged. So we're looking forward to releasing that. And again, our goal always, because we think it's somewhat therapeutic to ease people's anxiety, is to provide as much information as we can. Thank you.
Okay, thank you.
I understand that this is a challenging, uncertain time for Missouri and the nation. COVID-19 is affecting everyone, and it may seem like there is no end in sight. However, we will overcome this, but people must stay at home as much as possible in order to do that. This means staying at home unless absolutely necessary to get out. I want to remind everyone that there is a statewide order that has been in place for almost 2 weeks. On March the 21st, I ordered social distancing across the entire state of Missouri. We know many people have been following this order and staying home, and we greatly appreciate that. For those people who haven't, you're putting everyone at risk. As I said on Wednesday, this order expires on Monday, April the 6th, so we will be updating that at tomorrow's briefing. The bottom line is everyone should be staying home as much as possible. Let me just say this. If you want to protect somebody's life, if you want to save somebody from going into the hospital, take a good look at your own families, take a good look at your neighbors, take a good look at the people you go to church with, and who your friends are, and realize you have a part to play in COVID-19 and reducing this virus. You don't have to put people at risk. And the way you do that is you stay home. Don't be out if you don't need to be out. All the orders in the world we can fight and we can print and we can send out. But at the end of the day, you as an individual are going to have to decide, are you willing to protect somebody's life? Are you willing to keep people out of the hospital? That's what will really make a difference in the state of Missouri. And if we will all practice that, and we will do it, and we'll self-discipline ourselves, we will make a difference. But we have to take that on as individuals. We have to take it on as Missourians, is what we have to do. Thank you again, and God bless.